So today's Insta lecture session would be on Ewing sarcoma. But before I go into the details of Ewing sarcoma, I would like to explain the term sarcoma, because you would be encountering this term in many places. In simplest words, sarcoma means it's a cancer of solid connective tissue. What do we mean by connective tissues? Connective tissue means those tissues in our body, like bone, like cartilage, like smooth muscle, like skeletal muscle, which helps to keep our body tissues together, to connect our body tissues. So these are called connective tissues because it helps to connect the various body parts. Now, if a cancer arises from this solid connective tissues, we call it sarcoma. Like from bone, we call it osteosarcoma. From cartilage, we call it chondrosarcoma. From smooth muscle, we call it leiomyosarcoma. From skeletal muscle, we call it rhabdomyosarcoma. Now, the term Ewing of Ewing sarcoma came because it was first described in 1921, 98 years ago, by celebrated American pathologist Dr. James Ewing, who even adorned the Times Magazine cover. And he was one of the true giants in the field of oncology and oncopathology in the 20th century. He first noted it in a young kid, in a young girl's radius, this tumor. Now, coming to the Ewing sarcoma is one of the most aggressive and common sarcomas we've seen in young kids and adolescents. Rather, it's the second most common bony sarcoma we see in young children after osteosarcoma. And the patient profile has certain uniqueness. Particularly, this tumor shows some kind of racial variation. This is more common in whites compared to colored people, and also much more common in the males compared to females. And mostly we see them between the age of 5 to 15 to 5 to 20 years, and they can involve pelvis and long bones like femur, tibia, and all this kind of things. And a very important feature of Ewing sarcoma is that they typically arise from the diaphysis, the shaft of the long bones. So if you see a tumor arising from the diaphysis or the shaft of the long bones in a young kid, please keep Ewing sarcoma at the top of your differential diagnosis. Now, Ewing sarcoma has some other features, particularly how do we diagnose a case of Ewing sarcoma? Now, patients, the young kids, they typically present with some kind of pain and swelling in and around the bones or in the knee joint area or other parts of the body. It can also involve soft tissues, and often it mimics some kind of bony infection because it can present with pain, redness, swelling surrounding that bony area. And often they have high ESR, leukocytosis, high WBC count. So it is often confused with some kind of bony infection like osteomyelitis. This is a very important concept about Ewing sarcoma. Now, Ewing sarcoma, like any other bone cancer, they will be obviously diagnosed by the biopsy, the histopathologic features. And on histopathology, what we see sheets of small blue round cells, and the cells have very high nucleocytoplasmic ratio. That means normally a cell, normally in a physiologically normal case, we see that cells usually have nucleus and cytoplasmic ratio of 1:4 to 1:6. That means for one volume of nucleus, there should be 4 to 6 volume of cytoplasm. But in cancer cells like Ewing sarcoma, the cancer cell is entirely mostly made with nucleus. So the balance, the ratio is tilted in favor of nucleus, and along with the big nucleus, we'll be seeing a scant little amount of cytoplasm. That's why the tumor cells look more bluish. Why? Because mostly the normal hematoxylin eosin stain, the nucleus is stained by hematoxylin and the cytoplasm is stained by eosin. Eosin stains pink, and cytoplasm, that's why cytoplasm looks pinkish, and nucleus is stained by hematoxylin, that looks bluish. Now, as this tumor cells in this tumor are mostly made with nucleus, so mostly the tumor would appear bluish because the tumor is mostly made with tumor cells which are mostly made with nucleus. They have very little amount of cytoplasm, and that's why this is a prime example of small blue round cell tumor, because the tumor on biopsy, they appear that the tumor is entirely made with some small blue round cells, and that's why a group of tumors like Ewing sarcoma are called small blue round cell tumor. In this group, we can also have small cell variant of osteosarcoma, some non-Hodgkin lymphoma like Burkitt lymphoma. We can have embryonal variant of rhabdomyosarcoma. We can have neuroblastoma, and all these tumors, they are grouped together as small blue round cell tumors of childhood. Now, another characteristic feature of Ewing sarcoma, that the little bit amount of cytoplasm which these cancer cells have, they contain glycogen granules, which can be appreciated better in electron microscopy. But even in normal light microscopy, you can detect them by using a special stain called PAS, periodic acid C. So, because they will be positive, because the cytoplasm, this little amount of cytoplasm, they contain glycogen. And the most important concept in the pathologic diagnosis is use of immunohistochemical marker CD99. These tumors are typically positive. The cancer cells, they typically show membranous positivity for CD99, which is used by extensively in the pathologic diagnosis of this thing. So if you see that a tumor, they're describing that they're CD99 positive, it's a bone tumor, think about Ewing sarcoma. Having said that, this tumor CD99 is not specific for Ewing sarcoma. It could be positive in other tumors also, like synovial sarcoma, lymphomas. They are positive. They are not exclusive for this granular cell tumor of ovary also. So this is not exclusive. CD99 positivity is not exclusive for Ewing sarcoma, but they are used extensively, because I would say that they are rather sensitive for this tumor, but not so specific. Another characteristic feature of this tumor is a characteristic translocation 1122. So this is also used in cytogenetics for the diagnosis of this. So if we look at the other aspects of Ewing sarcoma, that Ewing sarcomas also are sometimes thought to be a part of a group of tumors. They are called Ewing sarcoma family of tumors, like primitive neuroectodermal tumors, Askin tumor, which is usually a small round cell tumor of chest. So these kind of tumors, they are grouped together as Ewing sarcoma family or Ewing sarcoma group of tumors. And another characteristic feature is that they usually have as due to the result of the translocation 1122, they usually have a chimeric gene product that is called EWS-FLI1, which is a derivative product at that translocation 1122. And this EWS and FLI1 chimeric protein could be detected by a reverse transcriptase PCR, RT-PCR, or FISH, fluorescent in situ hybridization. They can also be used for diagnosis. And this tumor has a tendency for metastasis. Typically, they metastasize to lung, and they can also metastasize to bone. So this is one of the bone cancer, which shows bone-to-bone metastasis. This is another important point of this. So what are the key features of Ewing sarcoma? I just mentioned Ewing sarcoma is a highly aggressive bone tumor, typically seen in 5 to 15 years of age, 5 to 20 years of age. It's a highly common bone sarcoma in children. Highly common, this is an uncommon tumor overall, but out of all the bone sarcomas, this is the second most common bone sarcoma seen in children and adolescents after osteosarcoma. They usually arise from the diaphysis of the long bones, and also can arise from the pelvis. Microscopically, they are characterized by their small blue round cell appearance. They usually have glycogen in their cytoplasm, which can be stain positive for PAS10. They show their characteristic translocation 1122, and also the formation of the chimeric gene EWS-FLI1, which can be detected by RT-PCR or by FISH. And they are highly aggressive tumor, often confused with the infection arising from the bone, because they have infection like features like fever. They could have swelling, redness in those areas. Those things you need to keep in mind. And in the list of the differential diagnosis, obviously those other small blue round cells would come, like neuroblastoma, metastatic neuroblastoma, like small cell variant of osteosarcoma, like rhabdomyosarcoma, which is metastasized to bone. This kind of small blue round cell tumors you need to think in the list of your differential, need to keep in the list of your differential diagnosis. And immunohistochemically, they are positive for CD99. Please keep it in mind. Okay, thank you very much.